There you go.
Okay. Now we're going to continue our assessment. I've been watching the patient and her ease of breathing. She's not struggling to breathe. She's breathing. Excuse me. She's breathing effortlessly. Now I'm just going to test her lung fills from the back. Okay. I'm palpating the skin on her posterior thorax. It's warm bilaterally. Her thorax is symmetrical. Alright. What I want you to do is every time you feel my hand touch you, I want you to say the word 99. Okay?
99, 99, 99.
Tactile fremitus is present, which is normal. And now I'm going to test your chest expansion. I want you to take a deep breath in and let it out. Alright. And there's a good distance between my thumbs to let me know that her chest expansion and thoracic expansion is good with her breathing. Okay. Now, let me grab all this stuff. I am going to do what we call percuss your lung sounds, and you're going to feel me tapping. So what I want you to do is, when I tell you to, take a deep breath, and I want you to hold it, and then when I say let go, let it go and hold it and just let that exhalation hold that. And I'm going to work really fast so you won't get uncomfortable, okay? Alright. Ready? Deep breath and hold it. Alright, let it go. Alright, you can relax. Okay, we're going to do it on the other side. Good job. Deep breath and hold it. Let it go. Alrighty, good job. Just relax. And the diaphragmatic excursion is 5 centimeters bilaterally, and normal is 3 to 6 centimeters. So that's good. Alright. Now, I'm going to listen to your lung sounds. And when you feel my stethoscope, I just want you to take a deep breath in and out through your mouth. Okay, very good. And for this assessment, we're only listening to 4 fills, but if I were to do a full assessment, I would listen to fills 5 and 6. Alright, now I'm going to do that again, but this time I want you to say the words 99.
99, 99, 99, 99.
Very good, and now I want you to whisper 99. Okay, and now I want you to go E,
E, E, E, E.
okay. And listening to the patient's lung sounds, they are clear without rales, crackle, or rhonchi, and her vocal resonance is normal based on her pronunciation of 99, her whisper test of 99. So that's all good also. Okay. Now I want you to turn around and lay back for me. Okay. And I'm going to look at your carotid pulsation, and I'm going to test for for jugular vein distension, okay? So turn your head away from me, and I'm just going to use this light because this light is not working. I can see the pulsation of the carotid pulse, and there's no jugular vein distension. All right, you can turn your head straight. Okay, now I'm going to palpate your carotid pulse. All right, and I do not feel any thrills. And now I'm going to listen with the diaphragm and the bell of my stethoscope. Hold your breath. Let go. Hold your breath. Good. Hold your breath. Let go. And hold your breath. Alright. No thrills, bruies heard. No thrills felt, no bruies heard. Very good. Alright, now I'm going to bring the sound down a little bit. And I'm going to palpate your chest around your heart. I'm looking for any heaves or masses, lifts. I'm trying to see if I can feel any thrills, okay? I'm also, while I'm palpating, I'm going to feel your point of maximal impulse. And that's felt. However, in the event that I could not feel this on the patient, I could have had her to turn to the left slightly, and it would have been easier for me to palpate it, but she has a very good one. Now I'm going to listen to your heart sounds with the diaphragm and the bell of my stethoscope. Aortic. Pulmonic. Now with the bell. Tricuspid. With my bell. Mitral. With my bell. The apex. And now with my bell. Heart sounds S1 and S2 are present, and there are no murmurs heard. Alright? Also, in checking lymph nodes, I could now have the patient to raise her arm, and I could check her axilla for her axillary nodes, but we're not doing that for testing purposes. And while I have her in this position, I could also check her inguinal nodes and for her femoral pulse, but we're not doing that for these purposes, okay? So now I'm going to inspect her stomach. I'm looking for any pulsations in her abdomen. I'm looking for any signs of ascites or fluid. I'm sorry, I'm just going to tuck that like that. Alright, so I've done an inspection. Color looks good. There are no masses or lesions that I can see. Now I'm going to listen to her bowel sounds. Bowel sounds are present in all 4 quadrants. And now I'm going to lightly palpate her abdomen. or tenderness or masses. Any tenderness?
No.
This is just light palpation. I would also do deep palpation for a more extensive assessment, and I could palpate her liver after percussing and finding it, and I could also palpate her spleen. But for these purposes, we're only doing light palpation. While I have her in this position, I'm going to test her abdominal reflex. And it is present. Okay. Now I'm going to have you sit up, please. Alright. I'm just looking at your arms. There are no masses. The skin is a normal color. There are no lesions. There's good skin turgor. Skin is warm bilaterally. I'm inspecting your wrists and your hands, your joints, bones. Is there any tenderness?
No.
Alright, there's good skin turgor. There's no swelling. Alright. Very good hygiene with her nails. Her capillary refill is less than 3 seconds. The nail color is pink. Her nails are normal texture. And her nails adhere well to her nail beds. Okay? Let's see, now I am going to feel your brachial and radial pulses and listen to them. Pull this arm all the way out for me. Alright. They are 2+ bilaterally. And now I'm going to auscultate them with the bell and the diaphragm of my stethoscope. There were no bruits heard with my auscultation, so that's very, very good. Now I'm going to test the range of motion of your hands. You can just, very good, and flap them side to side, adduct and abduct. Alright, there's full range of motion of the hands and the wrist. And just push up against my hands. There's good strength. Alright. Also, the patient has jeans on, so we're going to pull her pants legs up as best as we can. Can you get that one for me? I did a good job. Okay. Alrighty. I'm just inspecting her legs. The skin is normal, even hair distribution, no lesions, no masses that are seen. I'm palpating them. Skin is warm. There's good turgor. It's dry. There's no swelling present. Alright. So now we are going to check her pulses in her legs, okay? So just relax this leg for me. Popliteal. Popliteal. Posterior tibial. Posterior tibial, dorsalis pedis, dorsalis pedis. And we're going to listen to all of those with the diaphragm and the bell of the stethoscope. Okay. Okay, now we are going to check our reflexes. We're just going to do it unilaterally for the purpose of this exam. Otherwise, it'd be done bilaterally. First, we're going to check the biceps reflex. And it's positive. Now we're going to do the triceps. Positive. I'm going to turn that on out for me. Alright, brachial radialis. Alright. Might be easier to pull this down. Okay. Okay.
Mm-hmm.
Alright, the patellar. Very good. The Achilles with the flat part of my hammer. Very good. And now we're going to do the plantar reflex. And it's negative for the Babinski sign. If it were positive for Babinski, the toes would fan out. But that's a primitive reflex that's only seen in newborns. So that's a good thing. Okay? Alright. Now let's test the range of motion of your arms. You can raise them out. Good. In front of you. Very good. Back. Good. Now give yourself a hug. Very good. And hold them out for me. And just push against my resistance. Alright? There's good strength. Very good. To test the range of motion of the patient's hips, I would have her lay back supine, and I would abduct the hips and adduct them, and I would flex and extend them, and I would do this with resistance to test her strength. To test the range of motion of her knees, I would have her to extend and flex her knees, and I would add resistance to see how strong she was to test her strength. Alright? Also need to check your filling in your arms and legs, so you can just close your eyes for me. Tell me soft or dull.
Soft. Dull. Oh, sharp.
I'm sorry, soft or sharp. Sorry, dull or sharp. I apologize. Okay, do you feel this?
Yes. Yes.
Close your eyes.
Feel both of them.
Very good. Alright, and then the sensation in your legs. Close your eyes. Sharp or dull?
Sharp. Sharp. Dull. Sharp.
Alright, do you feel me touching both?
Yes.
Alright, oh, were you cheating on me? That's alright. Okay, now I want you to stand up, and let's see. You can go back to that corner. Actually, come back for me. Let's try it like this. I'm watching you walk. Okay, your gait is smooth. Very good. Now I want you to walk back to that corner, but I want you to do it heel to toe. I'm looking at your gross motor skills. Be careful. This room is really, really tight, but very good. You can come back doing heel to toe for me. Good. Okay, you can stop right there. Alright, good. Now, if you can turn around for me. I'm just palpating your spine. It is midline. There's no curvature, no scoliosis. Thank you for very, very good. Alright, now we're going to test your range of motion in your spine. I want you to bend over like you're touching your knees. Good. Alright, you can come back up. I want you to lean back. Very good. Now go side to side. Good. Good. And twist your waist. Just your waist. Keep these hips still. Turn your upper body. Good job. Alright. Now, there's some, have a seat for me. And when you do some more neurological testing with your coordination, I want you to do your hands. Very good. Now we're going to do more fine motor coordination. I want you to do your thumbs to your fingers. Keep those eyes open.
Oh, thought you wanted to go.
No, keep them open. All right, very good. Now I want you to close your eyes and touch your nose. Good, open them up. Now touch your nose to my finger. Alrighty, now close your eyes and hold out your right hand. What object am I putting in it?
A pen.
Very good. Keep those eyes closed and hold out your right hand. Alright. What number am I drawing?
3.
Very good. Now, I need your pointer finger. I want you to close your eyes. I want you to tell me if you feel 2 pricks or 1 prick.
2. 1. 2.
Very good. Alright. One more thing. Stand up for me again. Okay, perfect. And actually, let's come back over here. Camera can see you a little bit better. Come in a little bit. Okay, I want you to raise your arms and close your eyes. We'll do this for 30 seconds. Alright, it's been 30 seconds. I'm just testing to see how much you sway, and there's minimal swaying, which is normal. That's your Rumberg response, and that's what we want. And now I want you to stand on 1 foot for me. Very good. And hop in place. Very good. And I believe that concludes our assessment. Thank you very much, Dr. Gilmore.